you go.
Okay. Hi, everyone. I am the founder of Indipop, and I have with us today the co-founder of Redirect Health, David Berg, and head of membership for Redirect Health, Mike Bechtel. Thanks, guys, for joining us locally in Scottsdale, Arizona. Yeah. So I'm very excited to have you both here because I personally am a member of Redirect. And when I was experiencing leaving traditional health insurance, I met with you, Dr. David Berg, and I'm like, please explain to me the difference between traditional insurance and a health share. I'm so confused. Where's my premiums? What's my deductibles, co-pays? And you sat down with me and you basically said, there's another approach to managing medical needs. And let me tell you about it. Do you want to kind of take it from there and discuss that different approach?
Yes, certainly I will. And the first thing that I'd say is whether it's a medical cost share or an insurance, they're both ways to finance healthcare. And I think the mistake that we make in America is we put the financing of healthcare at the beginning of our decisions around our healthcare. And versus starting with the healthcare that we're going to need and then figuring out what's the best way to pay for it as a second step, not the first step. And an analogy I give you is we would never do that with our car or our car insurance. We would never go pick our car insurance company first and then figure out whether we're going to get a Ford or a GM or a Toyota. That just doesn't make any sense. But we do. But we always want to know what kind of car we need. Is it 4-door, 2-door? Is it fast? Is it slow? Is it got good mileage? Is it not? There's specifics around our car that we want to figure out first, and then we'll go figure out the insurance later. It is definitely important that we pay for our gas and our windshield wipers and our collisions and our insurance, but we never would make that decision first. And if we did, it would make the experience of having a car very expensive. And that's what's happened to healthcare in America, is that we put the insurance first. We pick our insurance company first, and then we let the insurance company tell us the rules. That's kind of like Geico or Progressive or Allstate telling us how many doors we can have in our car, or asking them, or them telling us what roads we can travel on and when we can travel and when we can't, and what are the in-network roads and the out-network roads. It doesn't even make sense in the context of a car, but somehow we've gotten used to it in healthcare. So we've reversed it. We said, let's start with the healthcare first, and we're going to figure out how to pay for it secondarily. Still really important. We have to pay for things, but we don't have to make it the first decision, the first thing. And when we do it that way, we reverse it. Put the healthcare that we need first for our families. Well, now we have more options. Because if we put the healthcare first, we can also figure out what we don't need, what we need, what we don't need. And if you start with the insurance, you're going to buy a lot of things you don't need. And don't be surprised if you pay a lot of extra money for those things you don't need. If you start with your healthcare needs for your family, you can eliminate naturally the things that you're not going to need. And then you're not going to need the same amount of protection for the cost. And that brings in other forms of payment, other forms of financing, including medical cost share, but including different types of insurance, including different types of deductibles in the insurance. And there's many different types of insurance or risk-bearing vehicles. Cost share is one. The traditional insurance is another. Stop-loss insurance is one. Fixed indemnity insurance, workers' comp insurance. There's so many different types of insurances. When we start with one type of insurance, we essentially pigeonhole ourselves into a certain way of doing healthcare where we're not going to get the things we need, and we're going to pay for coverages for things we don't need. So we just reversed the model.
And that's what I was experiencing personally myself with traditional healthcare. Is I was ending up with getting something for a what if, a big scenario. But what about the everyday stuff of sore throats, or I just need to see my doctor? I was going to be paying out of pocket for this, or even an ER visit. So I found the idea of a health share very appealing when I realized that, number one, there's a team that's going to walk me through and help navigate, almost like a triage. And number two, I'm paying for something that I actually do need. So it was very refreshing. Do you want to talk a little bit about that, about the model that you have?
Why don't I hand it over to you, Mike?
Yeah, for sure.
I work at it every day. I just created it. Mike is the one that makes it work every single day.
Yeah. So what I've seen, and if you take an individual, a family, I've got, myself, my wife, and 5 kids, or small, medium-sized businesses. I think what happens is that the current model stops working for us for whatever reason. what I've seen mostly is it's because of cost, but it could be for other reasons too. And what we knew is we needed to create an easy and really affordable solution for people, right? The healthcare system is very complex. If we could make it easy to understand and affordable for people to use. Part of our system, what we do is we strategically are eliminating, and you mentioned it, Melissa, I'll get into a little more detail in a minute, but eliminating a lot of the wasteful activity, right? Unneeded activity that happens in wasteful spending. If we can get rid of those things, that can drive the cost of our healthcare down to the way we protect ourselves with our healthcare. So what we really did was we created, and what Dr. Berg did was created an end-to-end solution, whether it was for us as individuals or our families or businesses, that really put all the things together that we needed. So, and we focused first on, let's put a system in place to take care of what you just mentioned. What about the things that happen every day? What the things that probably when we look at the care that we need, it's 80% of the care that 80% of us use all of the time, right? And it's things like, you know, I've got a sore throat, or I've got a sinus infection, or my neck hurts, or my back hurts. And we created this program where we said, why don't we, and I always tell the story because, you know, Dave's wife, Janice, is a medical doctor. And when you look at the way their kids accessed healthcare, right? And everybody that's listening, and for us, it was much different than we did growing up, unless our mom was a medical doctor. Janice never went to them and said, when is your effective date? What is your network, right? She would never say that to her children. She just took care of them in a meaningful way. And when Dave looked at that for our own, you know, our team members, our employees back in 2007 and 8 and said, well, gosh, what if all of you had the same access to healthcare that I had? And of course, we all jumped at that and said, yes, we'd love to have that. Now we have this ability to say 24/7, 365 days a year, we can talk to a medical professional, right? And think about all the unneeded activities that we were able to get rid of. And I give a couple examples. One is my youngest daughter, Ava, who's 10 years old now. When she was about 6 years old, I walked in on a Saturday morning and she had pink eye. Now I know she has pink eye. My wife's a nurse. We have 5 kids. We already knew we had pink eye. We already knew the prescription that we needed. But in the current system that we had, we would have had to go to a pediatrician or go to an urgent care, all to just get the drops. And honestly, it wouldn't have been me. It would have been my wife who would have spent half the day doing it, right?
Right.
I was able to just snap a picture of her eye through our app that we have, Redirect Health app, have some communication with a medical provider. They were able to say, yeah, we're pretty sure that's pink eye. That looks like pink eye. Diagnose that, write a prescription for me. I'm able to go over to the pharmacy and pick it up, and I'm back in the house in less than 30 minutes with a prescription. You can imagine my wife, right? Her jaw's on the floor going, how did you do this? Yeah. Because I never interacted with that stuff. But that would have been unnecessary activity had we gone to an urgent care or to pediatric office. And that would have been costs that would have gone on the healthcare system that we didn't need. So we built that in place. And then we said, well, what about all the normal visits that happen when you go in person, right? Primary care visits, maybe going to a chiropractor for a sore back or neck. And what if we just got rid of the copays for those things? And we encouraged people to call in and use care. And then when they needed to go in person, we would help coordinate, set up their visits, get their referrals set up, and we could get rid of the copays for those things. So now we created this plan through the Redirect Health Plan through Everyday Care that said, let's get rid of the cost associated with most of the care that most of us use. Then we realized, well, what about the what if part? Like you said, what happens if my appendix burst or if I tear my ACL or something happens? And we knew we needed a way to protect the cost of those things. And that's where we've partnered with different groups, but we've partnered with medical cost shares, right? And the medical cost share for a lot of people is, if you think of an insurance company, I pay a monthly premium. Before the insurance company pays, I have to pay my co-pays and deductibles and co-insurance, and then the insurance company pays. A medical cost share is a community of people where I pay my monthly membership. Before the medical cost share shares in the cost of my care, I'm going to pay what's called an initial unshareable amount. Okay, and those vary depending on the range that you want to have. I would pay my initial unshareable amount, and then this community, the medical cost share community, would share in the rest of the cost. And so we learned if we paired these two solutions together, our Redirect Health Plan, that is our everything for the routine care, we paired that with this medical cost share to protect from the high dollar care. And then we said, hey, we're available 24/7 so that as a member, we can help navigate and coordinate you through the system and make sure all those handoffs happen in really meaningful ways. We eliminated the unnecessary activity, and then we're able to eliminate the wasteful spending. And that's why you can drive the cost of the care down and make sure you get the right care at the right price.
And that's something that I hear, and I'm sorry to interrupt, with people that are finding out about indipop is, what's the catch, Melissa? It's too good to be true. And I said, well, number one, have you heard of a health share before? And most people haven't. So there's a lot of education component of that. There is another approach to managing medical needs. And I love the idea, and I have used it at 3 a.m. when I could not bend my arm. I used the app, talked to a nurse within 20 minutes. And I was thinking to myself, what would have been my alternative at 3 a.m? Would have been an ER visit at that point, right? Or I just hang out and wait until the morning when I can go to an urgent care. But we went through different questions to make sure that I wasn't in immediate danger or anything, meaning, because it was my right arm. But everything, by the time that I did see my primary care physician, it was navigated. And I wasn't used to that with traditional insurance. And I wasn't an ID card. It was an actual human being. Melissa, you're the patient. And I felt it was really refreshing. So I wanted to thank you for that experience.
Probably some of the people who are viewing this are saying, well, that just sounds like a normal telehealth call, a teledoc call. And, but it's not. So the difference is this. With all our members, we have their medical records in front of us. So when our doctor or nurse practitioner, whoever we escalate it to, is talking to our members, we have the complete medical record in front of us. That allows us to do a lot more than just say, go see your family doctor, or go to the urgent care, or go to the emergency room. Because if you don't have all that data and all that information in front of you, it can be somewhat dangerous to make a recommendation without knowing anything about the person that we're talking to. But the other reason why we're different, our members have a much different experience than if they just go to a traditional telehealth or teledoc type service, is because they have the ability to call us right back 5 minutes later and talk to the same person, or 5 hours later. And even if they don't, we're going to follow up with them. So the concept of being able to be in constant, continual communication with a team of people who have medical degrees and can help you navigate the system, they're expert guides around the system, with your records in front of them is key, so that you can communicate continually if you needed to, and then we follow up as well to close the loop and make sure that we didn't miss anything, make sure it didn't get worse, make sure it's getting better like we thought it would, or maybe even you have additional questions. How many of us have left the doctor's office in the car and go, oh, I forgot to ask them this? Or we get a prescription and we are afraid to go because we don't know if that prescription is $30 or $300 or $3,000, and every one of us has a story about somebody we know who got an unexpected, surprise $3,000 bill. Even if we can't point to the person, we believe we know somebody, because it happens so often in America that we get these surprise bills. So part of the reason we want this continual communication is maybe we're talking about so many other things and we have a prescription we want to order and you don't go fill it. Well, what are some of the reasons you don't fill it? Usually because of cost, or you don't know how much time it's going to take. So the fact that we're following up and saying, hey, just want to make sure you know that drug is still waiting for you at Costco or Fry's or Walgreens, whatever it is, and it's $2.14.
Right.
It's waiting for you, and it's $2.14. Is there any reason you can't get that? Are you feeling better? Right? And we want to know if somebody can't afford something. The last thing I want to do is have one of our doctors prescribe you a $50 blood pressure medication that maybe you take 1 month and then you can't afford it every month after that. Maybe it's the better medication, but I'd rather you took a $1 medication, $4 medication that you can take all the time than give you a $50 one you can't take. Because that great drug you can't afford to buy and can't afford to take, it's not very good for you. It doesn't do a lot for you.
Right.
I'd rather we're creating care plans that where our care plans comply with the constraints and the needs of our membership. And sometimes that means we can't prescribe the things we want to because they're a little too expensive, perhaps. And too expensive for some people might be $10. Other people might be $100. So we have to pay attention to the individual's affordability needs. And because there are some really good drugs that are almost as good and they're $1. Or you can go spend $50
and get something that says they're a little better with the scientific studies. But if you pay the dollar and you eat less, or you don't smoke, or you exercise more, that dollar medication with those other lifestyle changes are much more beneficial for you than a $50 medication you can't afford without the lifestyle changes. So my point here is it sounds like Teladoc sometimes, but it's so different because of all the other things around it, from looking at the data and the medical records to the follow-up to the continual communication to paying attention to what things cost. You're never, if you call a telehealth service, good luck having a conversation. What's this drug you just prescribed for me going to cost? Or what's it going to cost if I go to the emergency room? What's it going to cost if I go to the urgent care? And a lot of people don't follow recommendations because they don't know the cost. Even if it costs very little, if they don't know, they might perceive it's a lot more.
Well, and it also ranges from pharmaceutical care to imaging as well. I had a member in New York who needed to have an MRI, and that can range in rates from, and you've seen it before, hundreds to thousands of dollars. And Redirect was able to find 3 facilities in a mile different radius in Brooklyn, saving her $900 for that procedure because she was getting the fair medical pricing. So that's something that I think people aren't really used to hearing about.
Yeah. We just had a member who has continued to use have their major medical plan. I won't mention the company, but it's all the same. Mm-hmm. In New York City, and he needed a brain MRI. And when he figured out his deductibles and his co-insurance and his out-of-pocket max, that brain MRI is going to cost him $4,700 out of pocket. So he called us and he just assumed he should use that very expensive insurance that he bought. But he called us, and within half an hour, we had him a $350 MRI in New York City. Now, I might be wrong. It might have been in New Jersey, which is a 9-minute drive across the bridge from New York City. But we just knew how to navigate it. And maybe it was $600 in New York City, but it was $350 in New Jersey, which are very close together. Those two cities, 9-minute bridge, I believe. But what it definitely wasn't is it wasn't $4,700 out of pocket if he used his insurance. And that's something a lot of people are confuses people, because they think that the insurance is there to protect them from costs. And the insurance is there to protect them from big costs. Think about brain tumors, cancer, heart attacks, strokes, and it does a really good job of protecting from those costs. Insurance, though, does a really poor job of protecting us from costs and wasted time for the little things, as you mentioned. When I say little, I mean the frequent things: the primary care, the labs, the physicals, the chiropractic. I need a stitch. I got something poked me in the eye. My ears hurt. Like those things there. The insurance companies actually drive up the cost.
I do get a frequently, some of the top questions I'm asked at Indipop is, what if I get a dreadful disease? And I'd like to, maybe Mike can feel this one, about what happens if someone is a member and they're diagnosed with cancer or end up with a heart attack.
Yeah, and I was actually going to go there, because if you're listening to this, or you're going, well, what's the difference between this medical cost share and the insurance? There's got to be some side of this that makes it, what is it, right? And so the idea of medical cost share is, what they've done is they've put in place some measures to say, if you have a pre-existing condition. And so what we do is the medical cost share will look back over the last 12 months. They'll say, if you've had any symptoms or treatment over the last 12 months for that specific issue, medical need, that's going to be considered a pre-existing condition. And then what they've done is they said, we're going to create some sharing guidelines on that specific condition, and they share different dollar amounts based on the time frame. If I'm a brand new member and I come in and I have no pre-existing conditions and I end up with cancer or a heart attack or a stroke, then the key there is you have Redirect Health to call and to organize your care plan, right? Which is a key in this, is you've got somebody there to take everything from the starting point all the way through the finish point, the follow-up, the visits, the handoffs. They're rarely, with the conditions you've mentioned, there's rarely one pathway, right? There's always going to be different ways to do it. And we actually get our chief medical officer involved, and we have a second opinion program, right? So you mentioned stroke and a heart attack or cancer, where now there's 3 phases of discovery, preparation and decision making where I can actually bring people in. You can imagine if I ended up with cancer, it's not just going to impact me. It's going to be my wife and my parents and my siblings and, probably Dave. And I would bring them in on my team with the chief medical officer and say, and any providers I want to help me walk through that and make that decision. In the end, if it's not a pre-existing condition, if it's a brand new diagnosis, the medical cost share is going to, after I pay my initial unshareable amount, and if it meets their sharing guidelines, then they would share the rest of that amount there.
And the reason why they like working with us is because before the dollar amount is determined, we're going to make sure that the care plan is appropriate and necessary, and that we get all the things that are needed, all of them, into the care plan. We don't want to leave anything out that's necessary. But we also want to make sure the things that are not necessary don't get into the care plan and start disrupting people's time and travel and money. And so when we do all that work, the cost of that cancer care is dramatically less. And it's a much more efficient care plan. So then when we submit the final bill to the cost share, they know that they're paying the right amount. So there's a lot less administration in trying to figure out what was the right amount. When you deal with a traditional insurance, you're going to get bill after bill after bill after bill after bill. It takes a long time to get it finished. We coordinate all that so that from a member's perspective, if you do get a bill, we can't turn them all off. And some of them are going to be wrong. Mm-hmm. You just snap it on the app, send them to us, and we've got our file, we organize them, we work directly with the medical cost share. We don't want you, because it's so hard, you will mess it up. There is no possibility in America today with a complicated cancer or heart attack or strokes, any of the big things that you've mentioned, that an individual and their family can adequately navigate themselves through the system without wasting a lot of time, a lot of money, having a lot of unnecessary services, and unfortunately, a lot of suffering happens because of that. We want to stop that by being the expert guide, so they don't have to go through that when they're trying to recover from a serious disease or problem.
But the cost is pretty transparent, meaning it is a medical need over $1,000, so it would be part of that IUA. Is that correct?
Correct.
Correct. Okay. Yeah. I just wanted to.
So if the whole thing would normally cost $100,000. It's not atypical for us to get it to about $20,000 or $30,000 because it's the right price, and we get rid of the stuff that's just noise and messiness that doesn't need to be there. Mm-hmm. And then if it is $20,000, you'd pay the first $1,000, and then the medical cost share would pay the remainder.
Right.
Now, if it's being $50,000, the cost share would pay the remainder up to there. And if it was $1 million, they paid up to $1 million. Now we know that it never happens. I've never seen $1 million claim happen. Everybody talks about them.
Good.
I do this for 30 years. I've never seen one, but I'm told they're up there all over the place. I think it's just a way to scare us sometimes. And Melissa, I was going to say, if you think about your audience, right? A lot of your audience is self-employed, independent contractors, right, or small businesses, and they have a specialty in what they do, right? They're selling their services, and they say, "Hey, don't go do this yourself. Let us do it for you. We are really, really good at it. We might even be experts in our field." And when people say, "Well, how does this redirect health solution work?" It's the exact same thing, right? We're saying you don't have to do this yourselves. We have 25 years of history, right, where our clinic business, we've done over 3 million visits. All these handoffs we've gotten really good at. Mm-hmm. And when people say, well, this looks too good to be true, or how can this price be this? You're going to let us be the experts. You have us as a resource to do all this work for you to get the right care. And to get it, we're saying, hey, initiate contact with us first through our app, text, phone call. And that may help someone as an independent contractor or self-employed to say, how does this work? Well, people come to you and they ask you to do work for them because they're not good at it. And we've just said, just put your care in our hands because we're experts at it, right? We've done it so many times.
Yeah, no, absolutely. And it does relieve some of that stress to know that you do have a team, that you're not doing this by yourself. You're not just an ID card with a group number. You're a real patient needing care. And I think that's one of the biggest differences that I've seen working now or being part of a health share. Besides the fact that you're keeping the costs down. And so it's less out of pocket. And for some of the I guess, the dreadful diseases or catastrophic, to know that my portion would be $1,000 is a huge relief. You know, and many families out there are going through this with triple the cost for premiums right now and deductibles. To hear that, I think can really make a financial impact over the course of the year for healthcare.
Yeah, a lot of people don't realize too, and that with traditional insurance, if they get cancer, let's say they have a $1,000 deductible, or it usually doubles if they have a family, then it's $6,000. But once the plan year ends in January 1st hits, or maybe it's February 1st, whenever their plan year starts, that deductible starts all over again.
Right.
So you might really, really struggle to come up with $6,000 for your cancer treatment. But then January 1st happens, and you got to come up with another $6,000 really fast. And that is the most common source of bankruptcy in America right now, is trying to manage the deductibles, the out-of-pockets, with traditional insurance. A lot of people think it's the people who aren't insured who are going bankrupt because of healthcare. Not even close. 3/4 of the bankruptcies because of medicine, because of medical care, happen to people who have insurance. So, and it's because there's a false sense of security when I have an insurance card, and we've reversed that. And it's not. People might still have that with a traditional medical cost share, but the way we've combined redirect health at the front end and the medical cost share is only to pay for things at the end afterwards.
Right.
We don't run in that situation where people have a false sense of security. When somebody has anything happen to them, whether they need a school physical or they've got a cancer diagnosis, we want people to know what is your cost going to be, not just from now to the end of the year, but for the end until we are done with this cancer. And with the way we set up, we combined with the medical cost share, if you get cancer, it's $1,000 until you're done treating that cancer.
Right.
It doesn't reset every year, because cancer care does not stop on December 31st, unfortunately. It's going to keep going January 1st and May 1st, and there might be some ongoing treatment that lasts for several years. And we don't want somebody to survive the first year or second year financially and then go bankrupt because they've run out of money.
No, thank you for pointing that out, because I think that is also a big difference between the traditional insurance and a health share, which can play a big part, especially even if you break your arm and the following year it didn't heal correctly and you need surgery on that same body part. If I'm correct in saying that's the same medical need, you wouldn't have to pay it twice.
Correct.
Yeah.
Now, of course, if you break that arm again and
right.
falling off another,
don't do it. Yeah, don't do it. But I think we went over some of the big differences and what makes Redirect Health so unique and so special. And you know, I just want to put it out there to people that might be listening that if you're on the fence or not quite sure, of course you can come to indipop. And if you're not really sure, if you do have a pre-existing condition, you know, talk to us, call Redirect, call indipop and find out. I think it's better to ask the questions first before just either hitting enroll or saying, I don't know if it's right for me. So I appreciate your time. Is there anything else that you'd like to add that we didn't get to cover today?
No, I mean, I just thank you, Melissa. I know you know, for my family, my wife was a nurse at a major hospital here in Phoenix. We were spending about $10,000 a year on premiums. And then we had it would have been $9,000 of deductible before the insurance actually paid. So when I start looking at that, it's why I really gravitated towards this idea. Who has $19,000 to spend before insurance kicks in? And especially, right, there's lots of these, you know, your members of indipop, self-employed, independent contractors who are looking at, you know, $500-600 individual plans, $2,000 family plans, and you start to do the math and it just stops making sense, right? And there has to be a better way to do this. What I'm grateful for is when I came into this, I didn't have this history of confusion in health insurance. So this all makes a lot of sense to me. And I would just say, take a look at it, because when you start to look at it, it is just common sense. It's things that, you know, Dave can tell you, him and his family, he sees his wife, who's our medical director, do this hundreds of times a week, very intuitively and naturally. take care of people, and it has nothing to do with insurance. It's just because we're taking care of people, and the common sense approach of this is it's just awesome, right? It's really cool to see that we're taking this on and helping people.
Yeah, it'll never be logical to let your car insurance tell you what roads you can drive on and how many doors you have in your car and what kind of car you have. It'll never be logical. It'll never be logical for an insurance company to tell you which doctors you can see, which ones you can't. It'll just never be logical.
No, I'm very grateful that this option is in the market, that I was able to learn about it, that I'm able to take this information and start educating a whole population of people that are struggling. They're struggling with paying 3 times the rates or not getting the care or the level of care that they're used to. And I think this is an amazing alternative. I'm so grateful that I know you guys and that I can have you here today and that we can educate more people that there is a solution out there and you're actually treated like a patient. Like you're asking, just like your mom or your Aunt Susie, the nurse, what should I do? And maybe we lost that. So it's nice to get that.
Yeah, you know, we even take it beyond that. We do not want our members to be patients. It bothers us.
Oh.
Just like it bothers me when my kids become patients. I want them to be a family member. I do not want my kids to be patients. Similarly, we want our members to not be patients. So we will go into the healthcare system with them, get them better, get the things resolved, and get them out of it. But we don't want them sitting in there. And,
no, thank you for clarifying. Yeah. Yeah.
That might be a little for our members is we're doing everything we can to help them not be patients, and when they are patients, to unpatient them, just like I do with my kids.
I love that.
So we really appreciate you, and you matter a lot to us. So thank you for doing this and for supporting us.
Oh, absolutely. And again, and I'll put some information up for the viewers who watch this after the fact. But thank you, Dr. David Berg and Mike Bechtel. And again, you can find us, you can find Indipop at indipop.co. And I'll be talking to you guys very soon, I'm sure.
Okay, thank you.